Hello, everyone, and welcome back to the show. I'm your host, Levi with Mailbox Money, and today's guest is Dr. Jill Kruse. Jill is a physician with over 20 years of experience and the founder of Flight Time Medical, where she specializes in aviation physicals and pilot care. She also works as a hospitalist in the Brookings Health System and hosts On Call with the Prairie Doc, helping make medical topics more accessible for the public. Jill, welcome to the show. We're really happy to have you here.
Well, I'm really happy and thankful that you asked me to be on. This is going to be great.
Amazing. I always like to cut out some time at the beginning for you to kind of give some of your personal background and let people know a little bit more about you and where you're coming from.
All right. Well, born and raised in northwest Iowa, Inwood. I went to West Lyon High School there. And then undergrad, I went to Augustana, and then came up here to Brookings to SDSU to get my master's in microbiology. And then I went to medical school down in Des Moines at Des Moines University, and then finished my residency training at University of Wisconsin's rural training program in Baraboo. And then after that, came back to South Dakota and started practicing.
Amazing. You hit quite a few schools in there. You got the whole gambit, huh?
A lot of education. So.
Amazing. So I think my first question, besides your personal background, is going to be kind of what is this Flight Time Medical? I hadn't heard of it. I didn't know there was a specialized practice just for pilots.
Yes, so FAA requires all pilots to have some sort of medical certification. And there's 3 levels of flight physicals depending on who you are as a pilot and who's in the back of your plane. So the Class 1 flight physical is for your commercial pilots, so someone that's flying for Delta or United or American. A Class 2 is someone who's getting paid to fly, so your UPS or FedEx plane, cargo plane pilots, your med flight pilots, your corporate pilots who are flying around the executives in their jets, and our aerial applicators, so your spray pilots. So if you're getting paid to fly, you need a Class 2. And then Class 3 is the next class that is for people like me that are just flying for fun. So you're taking your family around, you're in a small plane, you're not taking a lot of people, and you're just having fun, can't get paid, but had lots of memories. So
what led going this? When did you know like that was the direction you wanted to go with in your education? Or maybe it wasn't part of it. Maybe it was post-education that you decided this is what I want to be doing.
Well, when I was in my first practice, one of the doctors there was an AME. So he was an aviation medical examiner that does those flight physicals for the FAA, and he was getting ready to retire. And all the pilots said, oh my goodness, we need someone else. You can't leave us. We need another person that will pick up this mantle and keep doing these physicals for us. And while I was down at my first job at a hospital Christmas party, one of the doctor's husbands was a flight instructor. And I said, just general conversation. I said, what do you do for your living? Oh, I'm a flight instructor. I said, oh, cool. I always wanted to learn how to fly. I thought that would be really neat. And he said, I'll meet you at the airport on Monday at 5 o'clock. I was like, what? I looked at my husband. I said, I guess I'm taking flying lessons. So I ended up taking flying lessons, got my private pilot certificate, and then it made sense for me to become the AME at that practice, because there was 2 doctors who were, myself and another Dr. Stagg. He wasn't a pilot, I was a pilot. FAA favors pilots to be AMEs, and then I had to go down to Oklahoma City and do a week-long training to learn what all of the FAA's specifications are for pilots to make sure they're safe in the air and that they're not going to have any sort of medical emergencies that would make them likely to be suddenly incapacitated is their verbiage. So they don't want a pilot passing out or having a heart attack or a low blood sugar or a seizure or any of those things. So you want to make sure your pilots are healthy, and an AME does those exams on behalf of the FAA in order to check out all those pilots and make sure they're safe.
I would say that is a very good thing that they are actually checking off those, because, yeah, I certainly don't want any medical emergencies happening while I'm up in the air.
Me either, and definitely not for the pilots.
You were kind of mentioning me before we hit record here. How common of a practice is this going on around here? Is there lots of AMEs? Is there very few?
FAA says the average age of an AME is 63 years old. So a lot of them are retiring, and that's what we're finding. The AME that was in Aberdeen has retired. The AME that was in Mitchell has retired. So, we're losing all of these AMEs. And then there's two levels of AMEs. There's a regular AME and a senior AME. And a senior AME has been an AME for at least 2 years and then applies to get this higher level where they can do the first class medicals for your air transport pilots. So I was asked by FAA to apply to be a senior AME after I was 2 years in practice, and they reviewed my charts and said, hey, you're doing a great job, please upgrade so you can see more pilots. So I am one of 6 senior AMEs in the state of South Dakota, and I'm the only female senior AME in the state of South Dakota. So here in Brookings, where I have South Dakota State University, all of those aviation students need to get a class 1 to make sure that when they graduate, they can get a job at the airlines to make sure they meet those medical standards. And I'm seeing a lot of young female pilots who would prefer to have a female medical examiner. So I'm really great that I'm able to be here and be that resource for them.
What is South Dakota kind of compared to maybe the normal? Is that normal that there's so few? Is South Dakota a little bit behind there? What do you see?
There's more where there are big airport hubs. So, Denver has a lot, Chicago has a lot, Atlanta, Fort Worth, Dallas. So if you've got a big airport nearby, there are AMEs, some of them even have their office in the airport terminal so pilots can just hop off, get their exam, and then take another flight out. But smaller areas and smaller states where there's less commercial airlines, an AME and an AME just doing this as their sole practice is quite rare.
Okay. That's I'm glad to have you on, and maybe is that something that I was going to say raise a little bit more awareness? Is that something that you're working with the school already, maybe raising some more awareness and trying to get those numbers up a little bit?
Yes, definitely. I've been actually I ended up being a guest lecturer at both Lake Area Tech at their aviation program and South Dakota State University when I talked to the students about medicals and things that could get them disqualified. If they're on certain medications, if they have certain diagnoses like ADHD, that's concerning and would require a deferral and special issuance from FAA. And then also things that they may not think about. So these college students, if they were to get a minor in possession or get busted at a college party, FAA sees that as anything related to alcohol or drugs is a very high risk red flag to the FAA. And you want to make sure that these students make good choices, and FAA is looking for pilots that make good choices. And if you get caught for, excessive speeding or alcohol issues, FAA will look into that. And actually, FAA will evaluate your driving record. They'll look 10 years back on your driving record to make sure you haven't done anything reckless or stupid in a car, because if you're reckless and stupid on the ground, you might be reckless and stupid in the air. So they don't want that.
Yeah, I agree. I'm glad it helped with such a high standard there. Mm-hmm. That's I never I guess it never really even crossed my mind to be thinking that in depth on it. So I'm glad there's people out there that are.
Mm-hmm. Yes, we always say FAA's goal is to keep FAA out of the headlines. We don't want any plane crashes for people doing things that are unsafe or that they were physically unsafe to be in the plane.
I kind of want to pivot a little bit away and just more talk about you as a whole, as a working professional. Obviously, you're running this practice, you're working in the hospital, you're hosting the show. How do you balance kind of all of that, and what keeps you moving forward?
A very good calendar that's synced to the rest of the family. So I know where I need to be when there are concerts and when I need to block off schedules. So really supportive husband, supportive kids, and just making sure I know where I need to be and when I need to be there, and trying to get all those calendars to coordinate, which can be challenging, and every once in a while I make a mistake. Actually, next week I'm scheduled to work in the hospital, and I had forgotten to block off this schedule, and I had a pilot, and I had to call him. I'm like, I'm so sorry, there was a scheduling error. I'm supposed to be at the hospital working on Tuesday. When can we get you in? So he's going to come in this Saturday, and I'll get him seen this Saturday, so he doesn't have to take a day off of work and mess up his schedule. And again, that's the beauty of flight time. When I was at another clinic, I wouldn't have quite as much control over when, and I couldn't make those pivots or changes quite as easy. So I always tell my pilots, if you need to get in, we'll make it happen.
Is that something that's, is there quite a few, I guess what I'm asking is it common practice that they're being able to be so flexible and do that, or is that something that is kind of more of a rarity?
It's definitely a rarity. If you would call down to the AME in Sioux Falls, it's 6 weeks out to schedule an appointment. Here in the other AME here in Brookings, I know it's 4 to 6 weeks out to get an appointment. If you wanted to see me, I could see you this afternoon. So I've had pilots call up and say, hey, I was going to get my medical renewed. It expires at the end of the month, but now my schedule has changed and I need to get it done now. Can you get me in this week? And I said, absolutely, we'll get you in this week.
That's awesome. Yeah. Pivoting again, do you have any advice for entrepreneurs that are in healthcare who are thinking about starting their own practice? What kind of advice would you give to them?
I would say don't wait till you have it all figured out to get started. Just do by doing. You can get so caught up in the how am I going to do this? What do I need to get done? That you just end up with analysis paralysis and you do nothing. So the best is to just do something, pick a starting point, and then you'll figure out the next thing that you need to do, and then the next thing that you need to do. And I actually ended up finding some AMEs who are doing similar individual clinics like myself. One, she's out in Michigan. So I found her on Facebook and I reached out to her. I'm like, hi, how are you doing this? How does this work? What software are you using for scheduling, and who did your website? And then there's another doc that I'm friends with out in Rapid City who also about 2 years ago started his own clinic, and he's like, you should do it. I was like, me start my own clinic? That's crazy. I'm fine just working at a clinic and letting someone else deal with all of that stuff. But honestly, it's been great to have the control of my schedule, the control of my time, and then the control of how I treat my patients here. Because when I was in clinical practice at the clinic, if someone showed up 10 minutes late, I'm sorry, we got to reschedule. You go. Now I call them up and I'm like, hey, you're running late. Is something wrong? And oh yeah, it took a little longer to pre-flight the plane, or oh no, the weather's a little bit bad, so I had to drive instead of fly. And I'm like, okay, as long as you're still coming, great. Or do you want to reschedule? Totally up to you. I'm fine with either. So I can be a lot more flexible, and I made my appointments a lot longer, so there's some breathing room in between pilots that come in. Actually, my last pilot today was scheduled to come in at 11 a.m., but he showed up at 10:30, and I was done with the previous pilot, and he's like, hi, I'm here. Can we start early? I said, absolutely. So 10:30, he walks in, we start doing the exam. He walks out at 11:05, and his appointment was scheduled to start at 11. So he was happy, I was happy. That wouldn't have happened at any other office I worked at.
I love it. And you mentioning reaching out to others, and I think that's a great bit of advice. People are hesitant because they think, oh, I'm bothering them, but I found most people love sharing that kind of information, and they want to see others succeed. So I'm really happy that happened for you too.
Yeah, I've had really good support from other AMEs. Actually, FAA requires us to meet in person, all the AMEs, to get together every couple of years. So my last convention that I had to go to, I was talking, and they'd have mixers, and I'd be talking to all these old AMEs. Again, most of them are in their 60s. But they would give me, their words of wisdom and advice, and it was really neat to connect and see what other people are doing and how people have made a practice that does just this profitable.
Can you tell us a little bit about On Call with the Prairie Doc, what you do in there and where people might be able to find that?
Yes, so On Call with Prairie Doc was something that was started by Dr. Rick Holm over 20 years ago, and it's on South Dakota Public TV. We also stream it on Facebook and YouTube, and it's a call-in healthcare program. Usually each week we have a topic, and we bring in experts, usually local doctors from the area, although we have learned how to use, during the pandemic, we learned how to use Zoom very well, so we've had remote guests from all over the nation. But we answer our viewers' questions, so they can email, they can call in, or they can post a question on Facebook for our guests to answer about whatever their healthcare concerns are, and we'll discuss that. So we really wanted it to be a way for people to get unbiased healthcare information that is scientifically backed and based by people who are physicians who are actively practicing now.
That's awesome. How often are you guys doing those?
So we do, since we are filming on South Dakota State University's campus, we use their Yeager Media Center, and their students are the cameramen, and we've got pre-med students who are answering the phones for us. We kind of go around the university schedule. So we film during the school year, and then in the summer we'll do reruns. But it's been a great, so we do every Thursday, unless South Dakota Public TV is showing other things like, state basketball. We're on, and do about 32 shows a year, 32 different episodes. So a lot of episodes compared to like most TV shows nowadays. We try to get in as many shows as we can in a year's time. And we still feel like we could have had even more shows we could have done and topics we could have talked about. But I've been doing that full time since 2020 as one of the 4 Prairie Doc hosts. So each of us takes a week a month, so it's not completely overwhelming for all of this. We also have a newspaper column, and that goes into about 6 different states to about 500 different newspapers called Prairie Doc Perspectives. And we also have podcasts and a radio show on South Dakota Public Radio that's on Sundays at, I think it's 2 p.m. and I think 5 or 6 a.m. It's too early for me to listen to. I always listen to the rebroadcast.
All right. That's all right. Before we wrap up here, I kind of want to hear, looking forward, what are you most excited about in any of those fields or all of them? Here in the near future, and then call it the distant future?
My near future goal is just to have more pilots find out about this clinic and kind of grow this practice. Right now, I'm calling it a nonprofit in the fact that everything I've earned has gone back into the furnishings and gone back into building the infrastructure here. So I've worked a year and have yet to pay myself. So I just want to have that, find more pilots to come here so I can help them. And actually it's going quite well. My first year here, I saw 207 pilots. My busiest year when I was at the clinic, I saw 190. So I'm already up from where I started. And this year, if I continue what I have been seeing, I'm on track to see 250 pilots. So it's growing, word's getting out. But there's always more pilots that can need help, and I'm always here to help them.
That's an amazing goal.
Yeah.
Anything kind of in the distant future that has you excited?
In the distant future, I would say that this would become my full-time job, and then I can stop doing hospitalist, full-time medicine there and just focus on this. I feel like this is kind of my way to coast into retirement when I'm ready to stop full-time at the hospital and doing those nights and weekends and holidays and just be here. And, Prairie Doc, we had our 20th season a couple years ago. I would love it to see it get to 30. So I want that show to just kind of continue growing. I would love to see it actually on network TV rather than just South Dakota Public TV. I mean, PBS has been great for us, but their funding sources, everything's gotten much more challenging recently. So if we can get more sponsors and funding for that, because that's all donation driven. We don't take like drug rep money. The big hospitals and health systems sponsor us, but we're trying to stay very pure in who we take our money from and not, go by their agenda. We want to make sure that we're giving people accurate information, not skewed by any large donors. So our viewers are our biggest donor source at this point.
Beautiful. Yeah. Well, Jill, can you lead people to for both Flight Time Medical and Prairie Doc, if they want to learn more, where would you send them to?
Yep. So Flight Time Medical. Honestly, if you Google Flight Time Medical, it'll pop up. But the website is flight-time-medical.com. And Prairie Doc is, I think it's prairiedoc.org. So, and you can see us on South Dakota Public TV, on Facebook and YouTube. We've got channels there. Prairie Doc also has Instagram, TikTok, and I think one other. Well, we're on all the socials.
Yeah, even the TikTok, huh?
Even the TikTok, yes. We've expanded.
They're doing dances yet?
Oh, no. Thank goodness, no.
Well, Jill, we appreciate your time today, sharing like I said, I think a lot of people aren't thinking about how they know the pilot's there, but they're not knowing all that goes into having them ready and hearing the people that are on the backside of the curtain getting them ready. So thanks for shining a light on that for us today.
Well, thanks for giving me this opportunity. It's been great.
Of course. Thank you, everyone, for listening. We'll see you guys on the next one.